Hi friends, today we are going to see a critical appraisal of a human study journal. Today I have randomly selected one journal from a British Journal of Pharmacology. First, I will be giving you about an overview of the journal, what is its study design, results, conclusion, and finally we are going to do a critical appraisal. Here, what is the title? It is a phase 2 randomized study of veliparib with fall-free with or without bevacizumab compared with placebo with fall-free and bevacizumab in metastatic colorectal cancer. So it is published in a British Journal of Cancer in the year 2018. So coming to study objective, it is given as the primary objective was to assess whether the addition of oral veliparib to fall-free improved the progression-free survival in patients with previously untreated metastatic colorectal carcinoma. Coming to study design, the study has 130 participants and it is a randomized interventional trial started in 2nd December 2014 and completed on 22nd September 2017. So it is a randomized trial. I will be giving you the link of the journal will be given in the description below. You can go through the journal and you can do the critical appraisal by yourself. Now we are seeing what are all the checklists in the Consort guidelines. So under each title we have to do whether it is given in the particular journal or not. So what is Consort? Consolidated Standards of Reporting Trials, that is Consort. So coming to critical appraisal, in the title and the abstract, whether it was identified as a randomized trial in the title, yes, it is clearly indicated in my study. Whether the summary of the trial design, everything was given, yes, it was given. Coming to introduction part, the scientific background and the explanation was also given, and the rationale was clearly explained why the drug was chosen, and the objectives, as it is specifically given as a primary objective. Next, coming to the trial design, it is given as an interventional trial and is also given as a randomized, but the ratio was not given and the masking was not done. It is a open label study. Third question, whether any changes was made after the trial was commenced was asked. Yes, it was clearly mentioned in the study. Next, coming to fourth question, whether the eligibility criteria was given. Yes, both the inclusion and the exclusion criteria was clearly mentioned in the study. All the inclusion criteria in which the patient was selected was clearly mentioned, and also the exclusion criteria, how the patients are excluded, also mentioned in the journal. Whether the study location was mentioned, yes, it was given. It's a multiple sites globally around the world. Coming to our fifth question, whether the intervention was clearly mentioned as the two group. Yes, it was given as a group A and group B, and how the trial was commenced, everything was given clearly. And coming to outcome, it was clearly given the primary outcome, secondary outcome, and also the safety measures also clearly mentioned. Any changes to the trial was commenced after the trial started was asked. No, there was no changes were made after the trial was started. Coming to sample size estimation, yes, it was given in the study how the sample size was calculated for the study, and any interim analysis was explained. No interim analysis was done for the study. Coming to randomization, no method was given how the randomization was done. Allocation and concealment part also not mentioned in the journal. Blinding, coming to blinding, it was not mentioned in the study. Coming to statistical method, yes, it was given, but the software which was used to do statistical method was not mentioned. Then coming to additional analysis, that subgroup analysis, yes, it was mentioned by one-way ANOVA and Fisher's exact test. It was given in the study. Coming to results, the participant flow, the flow diagram was not provided, and any losses and exclusions after randomization was not given in the study. Coming to recruitment, dates defining the period of recruitment and follow-up, yes, it was given when the trial was started and when it was completed, it's given in the study. Next, coming to the baseline data, a table showing the baseline demographic characters were given in the journal and the numbers analyzed as per the original protocol. Yes, this is the table which was given in the journal. You can see it in the journal, and also the graphical representation also mentioned in the journal. This is the secondary outcome which is also given in the particular journal. Coming to the ancillary analysis, results of each subgroup analysis was done but the PFS in each group was not mentioned clearly. Coming to 19th question, harms. Yes, the unintended effects also mentioned in the each group. It is given in the table clearly. Next, coming to the discussion of limitation. Trial limitation was clearly mentioned in the study. Coming to generalizability of trial finding, it is not mentioned clearly in the given article. The trial is applicable to general population. For randomization is done, but the external validity was not done because it is a multicentric study. Then coming to interpretation, it is consistent with the results. Yes, it was given in the interpretation. Other information, whether the registration number, it was clearly mentioned in the study. Whether the full trial protocol can be accessed, yes, it can be accessed. Source of funding and other support also given in the study. So to conclude, is critically analyzed. The lack of significant benefit and increased burden of the adverse effects in the study group means that we cannot recommend this combination as a routine strategy in colorectal carcinoma. Apart from the lack of mention of randomization techniques, allocation ratio, blinding, flow diagram, the study has followed the Consort guidelines. So this is about a journal criticism. Thank you. For the next few minutes, we are going to discuss about what is impact factor, what is H index and all. What is impact factor? It is a measure of frequency with which the average article in the journal has been cited in a particular year. It is impact factor. It will be there for each and every journal. Then next, coming to H index. What is this H index? It is the number intended to represent both the productivity and the impact of a particular scientist or a scholar or a group of scientists or scholar. This is H index. Then they can ask about blinding. What are all the types of blinding and what are all the software used for randomization and all, and what is SPSS? It is a statistical analysis in the social sciences. Like that, so many softwares are there. You have to know about each and every software names alone. Thanks for watching.